Hey, what's up? This is Dr. Richa and we are on Dental Talks. Now, today we are going to talk about something that I see most commonly in my dental practice, and that is dental caries or tooth decay, or quite simply, a hole in the tooth. Did you know that a hole in the tooth is generally the last manifestation of this disease? So now how exactly does this happen? Now this happens quite simply by a process called as demineralization or loss of tooth structure. Now this demineralization process is taken place by certain specific bacteria or certain cariogenic bacteria which are present on all tooth surfaces. They are numerous, such as strep mutans or streptococci sobrimus or lactobacilli. Now it's important to note that the bacteria which are strep mutans and strep sobrimus are generally seen in patients who have a high rate of decay in their mouth. Lactobacilli is another bacteria which is present in the plaque biofilm. Now, these bacteria feed upon our diet, that is the sugars from our diet and the starches from our diet. Now, again, please note that these sugars could be glucose, fructose, or sucrose, and they are present in all sugary sweets and fruits and sugary beverages that we have. These bacteria also feed upon the cooked starches from our diet, such as pizzas, pastas, and whatnot. Now, please note that this is important, that these bacteria cannot break down complex starches or complex carbs. They can only break down simple sugars or simple carbs. Now, once these bacteria feed upon these sugars and carbs, as a byproduct, they produce certain organic acids. What these acids do is they penetrate inside the tooth structure. Now, the tooth structure is made up of partly of minerals, that is calcium and phosphates. The minerals of the tooth is also called as carbonated hydroxyapatite. Now, it's also acid soluble. So once the acid enters it, part of the mineral can get dissolved in it. The calcium and phosphate ions are brought to the surface of the tooth and it is simply washed away by saliva. Now, this is the process of demineralization or loss of the tooth. One of the earliest signs of this disease is a white spot lesion and it is simply a white or a yellowish spot on the surface of your tooth. It's very difficult for a patient to spot this, but if you go to the dentist when a white spot lesion is present, the dentist will be able to reverse this. Now, this will be done by giving you certain fluoride varnish or application of fluoride or certain regenerating toothpaste. But if you miss out on this, or if you miss out on keeping your dental appointment, then this demineralization process will keep on continuing and there will be more areas of demineralization within your tooth and eventually it will lead to a cavity. So this is how a cavity is formed. More on this in later videos.